This segment of CoastLife is sponsored by Beebe Healthcare.
Well, when it comes to your cardiovascular health, you want your recovery time as a patient to be limited and your care comprehensive. At Beebe Healthcare's Cardiovascular Institute, their integrated care approach relies on advanced technology and incredible staff to make sure that your cardiovascular health care is as easy as possible.
The Cardiovascular Institute at Beebe Healthcare takes a collaborative approach to heart, lung, and vascular care. Dr. Paul Sierzinski, Chief Physician Executive, is one of many experienced and esteemed clinicians that provide the most advanced, highest quality clinical care. And he breaks down what Beebe's Cardiovascular Institute is.
Institutes are not new as a concept in healthcare. Many large academic centers have institutes. Here at Beebe, we're starting with the Cardiovascular Institute as a way to bring a number of different clinical entities, physicians, other clinicians, and partners to bring care directly around a patient. And so our focus for the Cardiovascular Institute is to bring cutting-edge technology and care in a frictionless way to patients for their care.
And just like how the care you'll receive at Beebe's Cardiovascular Institute is multifaceted, so is Dr. Sierzinski's role.
So I'm fortunate in my role to support a number of different clinical enterprises. The service lines as well as our institutes roll to me, so I'm able to support teams and physician leaders like Dr. Frey, who we'll be speaking to today, who's over our Cardiovascular Institute.
What does Beebe Healthcare's Cardiovascular Institute mean for patients?
What this means for patients as related to their care, and specifically cardiac, thoracic, or cardiothoracic or vascular care, is that one, we're looking for interconnected care. So we're looking to remove some of the work burden that patients need to do to get this different type of care. So we want to connect it and have it really either in one location or as streamlined as we can.
Complex cardiovascular problems require a multi-angled, comprehensive approach, and that's exactly what the integrated care at the Cardiovascular Institute means.
In general, when you have diseases that have complex scenarios, such as cardiovascular disease or vascular thoracic disease, we want to make sure that all the individuals along the care continuum have access to information, are able to bring that information to the patient, and able to provide the care as efficiently and optimally as possible. In addition, when we talk about integrated care from a community standpoint, we want to make sure we're bringing evidence-based care and evidence-based practices, which is why we're actively recruiting the best physicians to Sussex County and to here to Beebe Healthcare.
For Dr. Sierzinski, caring for the Sussex County community isn't just a job, it's an honor.
For me personally, I can tell you that my mother was a cardiac survivor, suffered a heart attack when I was 14 years of age. And the impact of cardiovascular disease to my family and to those who are either in my family, friends, or neighbors, it's significant. And so having the ability to bring what is a university-based concept, which is really connected care, evidence-based practice, and having that care coordinated around the patient is really the ideal for care.
The services provided by the Cardiovascular Institute are extensive as well.
So our Cardiovascular Institute, both with our employed physicians as well as partners and some additional partners, includes general cardiology, interventional cardiology, structural heart, cardiac surgery, thoracic surgery, vascular surgery, cardiac and cardiovascular imaging, as well as cardio and pulmonary rehab.
A big part of what makes the Cardiovascular Institute so good at what they do is their cutting-edge technology, which includes a new system the team is excited to roll out.
If you take a look at this room, it's filled with technology, but part of the connectivity that we're going to see within our Cardiovascular Institute is something that's going live November 1st. We're going live with Epic November 1st, and Epic is not merely an electronic health record, it's really a transformational healthcare platform. And so when we talk about how do we bring the specialists from Cardiovascular Institute to a level of connected care, we really need a tool like Epic to help us do that, not only to bring information forward, but to help bring access to care in the community.
Another beloved member of the Cardiovascular Institute is Dr. Muhan Frey, who brings his expertise to Sussex County.
So when I came here in 2008, almost 20 years ago, to Lewis, Delaware, I came from a bigger institution, bigger hospital, came to the small hospital. I was very surprised of what you could do here at Beebe Healthcare. You know, we started from a smaller program doing just a minimal procedure, now to deliver comprehensive healthcare, not only therapeutic, not only interventional, but also preventative. The nice thing also about a small community can deliver really personal care. which I tell you from all the patient that comes from DC, from Philadelphia, who have a second home here, the kind of service they receive is unmatched, I think, even in competing with a bigger institution.
As physician leader, Dr. Frey's role within Beebe Healthcare's Cardiovascular Institute is to help maintain and grow their comprehensive approach.
Being the physician leader of the Cardiovascular Institute today, my main concentration on guiding the overall vision of Beebe Healthcare to deliver, the best comprehensive care. Again, as I told you before, not only therapeutic, but from prevention to compassionate care. That's one. The second part, obviously, is to work on foster the relationship between our current physician, as Dr. Szynski alluded earlier, where we're going to try to work as a multidisciplinary team between cardiologists, cardiothoracic surgeon, radiology, and most importantly, also work between our private cardiologists and employed cardiologists. The other things I'm going to be working on recruiting talented physicians, or bringing talent to the area to deliver what our community needs.
As Sussex County grows, the need for cardiovascular care grows as well. That's why the Cardiovascular Institute continues to expand its team.
So, look, we're very excited about bringing the talent into town. Between physician, specialists, and APCs is going to help our patient receive top-notch care here at Lewis, Delaware.
Patients love Dr. Frey because he truly loves what he does, and he loves serving this community.
I'll tell you, at 2 a.m. in the morning when you come to the hospital to save somebody's life, talking to their family afterward, and when you save somebody's life, there's nothing, equal to that feeling. This is where you get up in the morning at 2 a.m. in the morning, you're tired, but the minute you save this life, you know what you're doing and why you're doing it for.
Well, one thing is clear, that at Beebe Healthcare's Cardiovascular Institute, the team there loves taking care of their patients, and they love taking care of the Sussex County community. We also love taking care of the Sussex County community and the coastal Delmarva community. There's more Coast Life coming at you.